delay. I beg your understanding. I am Tayfun Uzbay. This evening, we will feature COVID-19 in global pharmacies worldwide, and I will feel very much privileged to be moderating this evening's session. I currently teach at Üsküdar University in Istanbul. I teach pharmacology. I have a degree from Istanbul University, the Department of Pharmacy. I first of all would like to extend my gratitude to the FIP, the Turkish Association of Pharmacies, for their kind support, and also all of the other stakeholders who've kindly made this event possible. So the subject matter for this evening is COVID-19. As you would all acknowledge, it was back in December 2019 that COVID first appeared out of Wuhan province in China, causing a global pandemic. Now, it's probably the first time that we're encountering such a pandemic, but evidently the world has had to suffer once every century or so with such a worldwide epidemic. In spite of advanced technologies, the pandemic has brought the entire global economy to a halt. We haven't been able to prevent it, and for 2 to 3 months, we've all been economically finding ourselves in difficult times. And it's clear that it's nothing to be underestimated. Mortality has been escalating, and it is evidently something to be taken very, very seriously. It also taught us that there would be a hefty cost attached to not investing into healthcare and education. And furthermore, in terms of social welfare and the need to invest in a sound health infrastructure. The International Declaration of Human Rights mandates that regardless of faith, ethnicity, or of any other difference, we should all be able to access healthcare sufficiently, and accessing treatment, not just healthcare, apparently is a constitutional right, which is soundly entrenched in the Constitution of the Republic of Turkey, and also apparently in the Constitution of every single presenter for this evening. Now, the virus has spread worldwide, bearing in mind which, at the moment, instantaneously, the total weight is more or less presumed to be around 1 gram. The virus at the moment, worldwide, this virus has caused 7 million detected cases and unfortunately 400,000 mortalities around the planet. Unfortunately, people are still dying from COVID-19. Many countries have chosen to pursue a different strategy, which is quite natural. COVID-19 has been basically creating its own story specific to each and every territory, and countries have created more or less their own stories. But which is the best story, which is the right or the wrong story, we still have time to tell, and we're still trying to understand to the best of our efforts. Alongside physicians and nurses, pharmacists amongst the protagonists. They're among the top 3 players in terms of access to healthcare. The biggest risk group would be HCPs or healthcare practitioners, as far as exposure is concerned. In Turkey and elsewhere, they have been the frontliners in having to combat against COVID-19. Unfortunately, many have passed away because of this disorder. I'd like to extend my condolences to their families and loved ones, not just in terms of their preoccupation, but also everyone, basically, all humans worldwide who've passed away because of this awful virus. So what we strive to do is, because this is a pandemic, we'd like to focus on the role of pharmacies and pharmacists in general. This evening, we're going to unravel the role of the pharmacists, the precautions taken at a pharmacy level in each and every territory, how nations have been approaching the struggle or the fight against pandemic, and also the post-pandemic roadmap across Turkey, France, Britain, Finland, and Spain. We're going to be featuring highly experienced, very, very senior pharmacists that have kindly made it to this session. So let me tell you a bit about the flow, first and foremost. I'm going to be allowing each and every presenter to talk for 10 minutes in line with the framework that I have mentioned before. And I'm sure that they will be highly inspiring. Having had every one of them talk in the second round, what we're going to do is we're going to have you raise your questions or comments, and we'll do our best to try and take those questions. Right, without further ado, because I know that time is our most valuable asset, we have a pharmacist, Ahmet Çakan from Turkey, to take the floor next. What I'd like to do is, and I'm going to be doing this for every single presenter this evening, I'll say a few things about his background. Back in 2010, he came out of the pharmacy school at Hacettepe University. He's a community and pharmacy in Ankara. He's also had a former role of the chairman of auditors within the Chamber of Pharmacies in the capital city. The floor is yours, Ahmet. Thank you, Professor. During the course of this session, I shall also be doing a formal presentation, so I'd like to do that by switching my screen. Ladies and gentlemen, I suppose you can hear me, he says. There are no problems. Right, so my first message is the fact that you've made this possible, all of the stakeholders in and around the country. A big thank you to them. And before we start off, I'd also like to pay my tributes to all of the healthcare professionals who've fought a major battle. I'd also like to pay my condolences to those who've passed away during the rigorous fight against COVID-19. So a few things about what has been achieved in Turkey. Back in 2020, earlier on, or by January 2020, we had a scientific committee set up within the Ministry of Health. The chairman of the scientific committee is the Minister of Health, and it's an advisory committee in terms of public health care, infection, virology, internal medicine, intensive care, and pulmonary medicine, bringing together this kind of multidisciplinary team. It was initially 20 people, then went up to 38 people altogether. Since its inception, it met every single day, and it has been advising the Ministry of Health, according to which a roadmap has been designated with a view towards fighting the pandemic. And it's very much aligned to measures worldwide, but there are some measures peculiar to Turkey. Soon after the scientific committee was set up on the 14th of February, the Ministry of Health published disorders for 2020 guidelines regarding care, isolation of patients, and also detection, circumstances, conditions pertaining to care, and also what to do once diagnosis has taken place. So the guidelines have been, or the algorithm has been updated regularly. And also back in 2009, we had a pandemic influenza national preparation plan, which has been entirely adhered to. There were incremental approaches, level A, level B, and level C. Level C, which is 100% lockdown. Fortunately, we didn't have 100% lockdown. We had partial lockdowns. We had seniors above the age of 65 undergoing curfew, and also those younger than the age of 20 not permitted to go out. We also had lockdowns during weekends and during public holidays, which was a nationwide curfew. In order to reach the origins and also to do contact tracing and the origins of the virus, we had surveillance teams, especially to be able to detect and to design mobile applications to find out how risky each and every neighborhood is. I think the scientific committee has done a fantastic job to combat the virus. Number of cases in Turkey are as follows. Mortality is very seldom, relatively, because the population is relatively very young. The treatment algorithms are very, very successful, and we've had enough capacity in terms of ICU beds available. Post-pandemic, we're currently entering, or we're about to enter, a phase of the new normal. The Minister of Health tells us what needs to be done, the sorts of rules and principles that have to be complied with. Many guidelines have been published already regarding the new normal. It's probably not going to be protecting us against the virus altogether, but the WHO has clearly mandated the wearing of masks out in public areas, calling out to every government to make that compulsory. And we have to watch out. We know that from the very beginning, the Minister of Health has mandated that we must wear a mask. We have to keep our social distancing. So the new normal really pertains to, or is all encompassing for all industries. But I'd just like to say a few things pertaining to pharmacies in particular. It's digital transformation, which is basically nearing, especially for healthcare provision. Many services will be delivered remotely in terms of diagnostics and care or treatment, but specifically from the perspective of pharmacies, there has to be a pharmacist within the scientific committee. Our professional organization, the Union of Chambers of Pharmacists, has been lobbying with the ministry to make us present in that scientific committee in order to make our voices heard. We will also be needing protective measures, standardized protective measures, post phase one, code of conduct, from now onwards, and also the kind of things that must not be cumbersome for each and every pharmacy. So throughout this process, I think pharmacies have done their best to try and fulfill their role. Community pharmacies have undergone major risk of transmission, but they've done a wonderful job in terms of delivery, provision of healthcare products. And they've once again proven a fantastic track record. Disinfectants have been widely available and have been manufactured at a pharmacy level according to formulae delivered by scientists. And because there's been such great big demand, disinfectants had been soaring in terms of price tag, but thanks to kind of local production at a pharmacy level, the prices were pulled down. And also, without having to go into a healthcare practitioner, prescriptions could be fulfilled at a pharmacy level. The ministry also took the following decision. Masks could be made available free of charge at a pharmacy level. These masks were sent out by the ministry and they were dispatched by the pharmacies throughout the community. So that meant that there was a great risk of contracting the disease in terms of the pharmacists. That was a great hindrance. They handed out 100 million masks altogether, and that meant like 100 or 150 additional patients that they've had, or customers they've had to cater to per day. So when there are extraordinary circumstances, the biggest problem is disinformation or misinformation. Likewise, professional organizations in and amongst the pharmacy community have done their best to prevent the spread of misinformation. Turkey has a great deal of migrants or migrant community. The government provides 100% reimbursement for them, so their prescriptions could be fulfilled at a pharmacy level. Academia prepared or designed clinical trials, especially for vaccines. The Healthcare Institute received one design from Marmara University, 3 different clinical trials done on animals so far. Veterinarian institutes or schools have been also working on clinical trials. Hospitals likewise were risky areas. So in terms of making sustainability possible, sustainability of provision of services, I think they've done also a great job. Those working in public healthcare hospitals, they've had to adhere to 100% kind of permissions, prohibitions in terms of non-indication, and also pertaining to clinical trials. They've done a great deal in terms of procedures. In terms of the pension fund or the reimbursement agency, prescriptions were closely monitored, prescriptions were paid, and they too have had to deal with a great deal of risk of transmission. Throughout this process, obviously the location of every single pharmacy is unique and physical conditions differ. There was a bit of lack of standard measures, but a lot of communication happened, and they've all uniquely done their best. There were barriers to foster isolation, distancing, a lot of PPEs, and lots of service encounters outside the pharmacy. The individuals working at the pharmacy received a lot of communication on how to watch out. There were a great deal of visuals, posters, and patients were asked to adhere to social distancing measures. And there would only be 3 clients allowed inside the pharmacy in one go. And there was rigorous air conditioning. Initially, it caused a great deal of chaos and anxiety, not just in Turkey, but worldwide. And it did create or bring about undesirable circumstances. And it has somewhat made us all feel rather jittery and miserable. Once the curfew was announced, within 2 hours, you saw big crowds gathering out on the streets because people thought, oh my gosh, we won't be allowed out. Shops will be closed for God knows how long. And that did cause quite a bit of chaos. But then again, people trusted and they very much complied with the rules and regulations of public entities. And just to repeat, there was free of charge masks handed out to people in Turkey, to all citizens, because of which, and by the way, the system went live immediately. And there were a few pitfalls. From time to time, pharmacists did have to deal with patients and their anger outbursts. And there were also, I think that throughout this time span, people have come to appreciate just how valuable the community pharmacies are. In terms of COVID-19, the Minister of Health in Turkey has taken sound decisions. These decisions were taken fast and they've been very, very effective. So the last point is it yet too early to go back to normal, the new normal? Perhaps we shall see. It's a matter of debate. Ahmet, my dear colleague, I thank you very much. It's been a fantastic presentation. And I also would like to thank you for being so strict in terms of timing. In front of me, I have another screen and I'm seeing lots and lots of questions trickle in. Some of these questions I'd like you to take before we proceed, perhaps. One of these questions is, worldwide, how many pharmacists died? Says one pharmacist. We have vice presidents of the FIP. I don't know this. Anyone want to pitch in? How many pharmacists died worldwide? That's one question. The second question is, pharmacists worldwide, okay, so we now got to listen to Ahmed. But there's one question that says, has there been government support in other markets to pharmacies? So is there anybody who might want to take the microphone? But before we proceed with speaker number 2, the chairman of the Union of Pharmacists in Turkey, Mr. Erdoğan Çolak, has sent in a message in terms of thanking the FIP and also thanking every single person who's speaking this evening. So a big thank you to them. So I'd like to extend his greetings, his gratitude. Ladies and gentlemen, let's now proceed with the second person to talk this evening. Attending from France, a pharmacist, Madame Jacqueline Surigu. Madame Surigu currently works as a hospital pharmacist and is the vice chairwoman of the FIP and also the chairperson of the hospital section. In terms of the Pharmaceutic Technology Forum, also the former chairperson and the former chairperson of the European Federation. Yes, Madam Surigu.
Jacqueline, you are muted.
Sorry for this. Is it? Can you see my screen now? Is that okay?
You need to make it full screen, please.
I don't see the...
Please go on to presentation mode, you know.
Okay. So I thank FIP to give me the opportunity to tell a bit on my country, France. France has been severely touched by the virus. We have today nearly 29,300 deaths. And with this number, we rank number 3 in Europe and number 5 in the world, after USA, UK, Brazil, and Italy. We have been declared by the French government the status of national health emergency, and we are still under that status today. The government has issued contingency plans together with the scientific committee on a national level.
Sorry, Ms. Jacqueline, sorry. You need to make it full screen on the presentation mode, you know, just...
Yes, but I don't see it like before, so I don't know how to do it. Is this? I don't see the parameters. The parameters are not on the screen as before.
First, you need to go presentation mode on full screen.
Can you see my cursor? This is where you need to be clicking, right here.
I don't see anything from you. I'm sorry for this.
I think it's okay. It's fine like this. There we are.
Ah,
exactly.
Yeah.
Then you need to change the parameters again. That's it. Yes, thank you very much.
So the whole profession responded to these contingency plans. And I wanted to give a little quote to all those pharmacists who have been rallying together in alignment to the contingency plans. First of all, the pharmaceutical industry for their swift reaction and anticipation as far as they could. The wholesalers and wholesale distributors, they have been showed great adaptability. They are very resourceful force, and they have been involved now in the community hospital coordination that allows a patient to collect his hospital treatment from a community pharmacy, grace to a coordination between hospital and community. And this is very efficient presently. Also, the pharmacists from the health agencies and regulatory bodies who have been given instructions to implement the contingency plans, and the pharmacists for learned societies, association unions for their insight and very relevant guidance. The pharmacy university have also been able to put a lot of their courses online. And those pharmacists, which I put here at the end of my slide, are the ones who are really in front line, and especially the medical biology pharmacist, which is a, medical biology pharmacists exist in France and some other countries, but not in all the countries. And they have been, they are in the front line sampling for tests and testing with either microbiological test or serological test. So they have been very, very busy and still are. And community pharmacies, hospital pharmacy, and also military pharmacies, as I will show in the next slide. Globally in France, the safety measures have been well respected. Social distancing has been organized with all those stickers. We are very familiar with that now. The cleaning procedures have been adjusted. Staff has been educated and protected adequately with the personal equipment. We are now used to see those plastic screens and shields, plastic shields. Also, the pharmacists had a great role in educating the public on preventive measures, and you can find everywhere those posters or flyers in pharmacy, community pharmacy, as well as hospital pharmacy, and also the alcohol-based hand sanitizers at the entrance of all the pharmacies. So I wanted to go in a bit more in details in the contingency plans which are put together in response of the different shortages, because shortages have been really a great problem at a certain time in France. The first shortage was on hydroalcoholic solutions, and the Ministry of Health issued an official text which allowed pharmacies to manufacture those solutions, which hospital pharmacies and some hospital pharmacies and some community pharmacies did. The manufacture was according to the WHO guide, which is on WHO website and also on FIP COVID Hub website. And an alternative, which was also developed in hospitals, was about reconditioning jerry cans, because the shortage was linked not to the availability of alcohol or other ingredients, but to the availability of plastic packaging. So we did recondition in the recycled flask and bottles. Another contingency plan which was put in response with shortages was what has been decided for masks. We were short of masks, especially at the beginning of the outbreak. We had a surgical mask and FIP respirators which were distributed, but they were only for healthcare professionals. And so the big stockpile from the French state went to healthcare professionals through the community pharmacies according to strict rules, which were edicted, so many masks per week per type of healthcare professionals. And to hospital pharmacy, we have been a bit more lucky. Those, despite hospital pharmacy have been experiencing shortage at the beginning also, but we had those donations from the H1N1 pandemics. Many industries and other manufacturers kept those stocks from this H1N1 pandemics, and we could extend the expiration date if the storage condition had been adequate. So hospital pharmacy could provide all healthcare professionals. Now, of course, it's a bit different because of the new alternative mask coming on the market. And the third plan, I wanted to go in details a little bit. It was about the shortages of drugs in hospital. With the ingoing flow of COVID patients, we realized very, very shortly that we would have out of stock of propofol, midazolam, and curalis, and atracurium, cisatracurium, and rocuronium. And this is the contingency plan which has been put together and centralized by the National Agency for Drug Safety. the national agency collected the data from hospital pharmacies every day through this national platform. So every day, every hospital pharmacy had to put the data of its stock in this national platform. And the national agency aggregated all those data with a number of COVID-19 patients and the activity of ICU wards other than COVID. And then from this aggregation, it could propose a distribution of the national stocks to every regional agency, health regional agency. We have 13 in France. And then the delivery to each hospital was performed, was done. Also other measures like dose-saving measures and therapeutic alternative measures were measures that had to be taken on local level. It was for hospital a complete change of target. Standard activities were withdrawn to give room to COVID patients. It has been a tsunami somewhere. We had to reorganize the pharmaceutical products delivery to the ward. And some hospital was so overwhelmed with ingoing flows of COVID patients that they got help from military force. And you can see here, this was mostly in the east part of France. Mulhouse Hospital, for instance, there was a military hospital which was built so quickly on the parking area of the hospital. You see how it was inside. You see here patient being transferred in that military hospital. Also, military hospital has been very effective, transferring patients from the East France to less affected area. And you can see here transfers by train. You see here the inside of the train, how they put the mattresses on the seats, and the luggage storage, which was used for the infusion sets, also by helicopter or plane. We had also help from volunteers. It was amazing to see all this, how it worked. Finally, I wanted to finish my presentation with an optimistic slide, saying that the COVID crisis was also an opportunity to change the supply chain, to enhance e-technology, and to explore new arenas for pharmacy. I have put here some of the measures that were put in place, like home delivery service. It has exploded. Community pharmacies has done a tremendous work, very good. Remote counseling, also remote dispensing of prescription. Of course, virtual meeting, teleworking, and apps of social media have had a place. I wanted also finally to quote that there was an extension of the delivery up to 3 months for chronic treatments, NCD, non-communicable diseases treatment, even if it was out of date prescription. And I hope that some of these measures will stay in the new normal of pharmacy. Thank you so much.
Thank you very much for this great talk and for the information that you have kindly provided. We now would like to move on to the next person to talk this evening. In the meanwhile, your questions are trickling in. I'm kind of going through, and we will try to answer these questions and comments as much as possible in the second round. Let's now move on to Professor and pharmacist from the UK, Mr. Ash Soni. He is a community pharmacist in the UK. He is also one of the vice presidents of the FIP, the Royal Association of Pharmacists, is where he was the former chairperson, and has resumed various different leadership roles. Yes, Ash, the floor is yours, if you would kindly proceed.
Thank you, and thank you for the invitation to speak. A lot of what I'll cover will be similar, because I suspect that many things that we've done over the course of time have been very similar across the world. But specifically, I'll look at what happened in the UK. So when this started, when we just started to move into lockdown, it was a bit of the, why is my slide not moving? Oh, it was we moved into lockdown. It felt like a tsunami. It literally, the influx of prescriptions, requests, demand from patients, expectation from doctors was enormous. In a matter of days, we had queues outside the pharmacies. We had patients waiting for prescriptions, where we'd been able to prepare prescriptions in very short periods of time. Suddenly we were asking for 24 hours to prepare repeat prescriptions, and we were only able to do urgent prescriptions at pace, and we had to ask patients to extend the time they were taking to wait for us. And one of the things that we had to do as a consequence was we had to increase hospital capacity, because effectively we were concerned at seeing the data that was coming from other countries in terms of how health systems were being overwhelmed. And many of the pharmacists that were working in hospitals and in community were redeployed to these sites. And this is an example of one of the hospitals that was built at very rapidly. And you can see this is a very big exhibition center and was capable of accommodating 4,000 patients and was built in about 2 weeks. And these were known as Nightingale hospitals. As I say, at the same time, virtually all services were suspended, apart from basic dispensing and supporting and managing COVID-19 patients. So what were the challenges we faced? Well, again, the shortage of PPE, introducing social distancing, which had not been done prior to anything like this. And from a pharmacy perspective, the challenge we faced was that we were learning this as we were going, because we were effectively at the forefront of what was being delivered. So the creation of social distancing, the lack of PPE, and actually persuading people not to come to pharmacies and not to come out if they didn't need to, and particularly to recognize that if they had any symptoms, not to enter buildings and increase the risk of transmission of COVID-19. And again, we suddenly found that as a consequence of this surge, that we had many more requests for deliveries, and particularly as we had created this category of shielded patients. So we had asked all of those over the age of 70 to self-isolate, but we also then produced a cohort of patients who had significant long-term conditions which put them at greater risk to shield and again to self-isolate. And as a result, pharmacies were expected to increase the number of deliveries very rapidly to meet this demand. But the funding to accommodate for that took a long time to agree. And the challenge we faced was, again, that lots of the things that we were doing at the same time as people were trying to learn how to manage and support patients and the public. And the consequence was that we were being effectively leading some of the changes that were going on, and there was a great delay in getting resources to us. But there was some recognition of what a wonderful job that pharmacists were doing and how well we were helping to support the public. The problem was, in a lot of cases, this is what we got. It was a great job. We got some very nice, warm words from politicians. And actually, it was the patients that were much more prone to support what we were doing in pharmacy. And we had, in the UK, we had a weekly clap that started for the NHS. And in a number of cases, patients said that they specifically wanted to include their pharmacists as being a key component of supporting their care. How long was this all going to proceed for, though? You know, in a way, when it started, the presumption was that the demand we were getting, the expectation on pharmacists was going to be for a short period of time and that things would settle down again. But what was become apparent is that this is not a sprint. This is a marathon, and that we are continuing to learn and to develop and to need to think about how and what we are doing to meet the needs of our patients from a pharmacy perspective. So what is the new normal? Well, the same things apply. Do you have any of these symptoms? You need to self-isolate. And we now have track and trace here in the UK. We have over 40,000 deaths, which makes us one of the highest countries in the world. Technically, we're only behind the US, although there are some debates about some of the countries and their figures. But as a result, even now, we have this need to make sure the public are aware of the risks they carry. so not to enter premises if they have these symptoms. To recognise that social distancing is continuing to apply and that you will continue to maintain 2 meters distance, which is probably some of the highest in the world. And this is making it more difficult in some cases for other sites to reopen. But again, pharmacy has been at the forefront with the installation of perspex screens, with maintaining social distancing, with restricting access at the same time for our public and for the patients coming to get their medicines, and increasing the amount of deliveries. And the expectation for increased use of PPE. In fact, we're expecting over the next 24 hours, we've seen notification today that people in pharmacy will be expected to wear masks in the dispensary because of the dangers of being able to maintain social distancing. And actually for all the public as they come out and are entering premises to again be wearing masks. This is becoming the new normal. So we are still waiting, and these are the things that we're going to wait for. There are 2 solutions potentially that we're looking at for COVID. The first is vaccination, and the UK is leading in many of the areas around vaccination programs. In fact, the vaccination trial that is being conducted at Oxford University is probably the biggest there is currently going on. And the other area potentially is to wait for pharmacological solutions. And we've seen that with the fast tracking of drugs like remdesivir in terms of its use as reducing length of stay, but what so far they've not been able to find are drugs which reduce mortality. But there are over 1,000 clinical trials going on that pharmacists are heavily involved in terms of making sure that we are able to get to where we need to be able to get, and to be able to provide some solutions for some of the challenges we continue to face for society, and not being able to get back to the normality that we would expect. And pharmacists are key and central to all of this. So from me, thank you very much. It's been a pleasure, and I hope this gives you some insight into the things that have happened within the UK.
Thank you very much to my dear colleague for this fantastic presentation. And we feel highly inspired already, and you've ended right on time. A big thank you. I now would like to pass the microphone over to a northern country, up to Finland. And from Finland, we have Eva Teresami, a pharmacist, who's going to be presenting to us this evening. Dearest Eva, she's a community pharmacist, and once again, she too is a vice president at the FIP. And once again, as far as the FIP is concerned, she's also the former professional secretary general of the community pharmacies section, the former chairperson of Europharm, a member of the steering committee and the action force. Yes, Eva, the floor is yours, madam.
You are muted, Eva.
Okay, so sorry for the confusion, and thank you for the invitation. I try now to explain to you what has happened in Finland, which is the Nordic country, one of the 5 Nordic countries. And what is, I think, is quite interesting here in Finland is that we have already before this pandemic had a contingency plans in every level, and the last ones being from the SARS time. And we also stock in the country medicines regularly for 6 months used. So in a way, we are quite well organized. We were quite well organized even before the COVID started to spread in the country. And all the processes, what has to be done, and also the roles of the different levels and organizations were taught beforehand. So we had national contingency plans for the country, for the healthcare, and for pharmacies even before corona crisis. And in the local level, we also had plans for local healthcare and for the pharmacy. So it was just to take the dust away from them and see that what parts are valid. And these plans are all updated regularly, and so there was no need for new structures to set up. And the roles of the government and the role of the Ministry of Health and the National Agency for Medicines are quite clear also, and as is for the professional pharmacy organizations. And all these, the government, of course, takes care of the regulation and together with the Ministry of Health. And then we have the guidance and the education and the follow-up of the actions, and the information every of these organizations know what they should do and what are the expectations. We got the legislation for national corona pandemia handling in 12th of March, and based on this new law, we also got some regulation concerning medicines and the dispensing procedures. The role of community pharmacies is about what it used to be also before this pandemic. So to guarantee the accessibility to medicines and medical equipment to the population. And this includes the procurement processes so that they are safe and we get everything what we need. The dispensing processes, which were a little bit we got some exceptions what we can do and what we cannot do, and the most important part possibly to inform the customers who aren't used to get their information about medicines from the pharmacies. The pharmacy owners, we have private pharmacy system here in the country. They also have their as an employer role, taking care of the safety of the personnel so that every task can be fulfilled. And also, if the pharmacy wasn't beforehand organized the distance services, this was the last moment to start with them. I want to thank our public because it has been responding very well on all the instructions. The safety distances have been kept. There is also a joke about the Finnish people that they now, when the 1.5 meter has gone out, now we can go back to the normal 2 meters. So that's a question. Frequency of visiting pharmacies went down immediately. So instead of coming every day, they started to come when they really are in the need to come. And the distance services were taken in the heavy use. So for example, in my pharmacy, the distance services were 10-folded. There was no holding and no panicking after the first days. Then everybody understood that the medicines will not finish and everything will go on as normal. Here we see a number of the numbers of new COVID cases in Finland, February-June 2020, and as you can see here in the end, we are almost in the zero level now, and the country is reopening again, and we will see there is a heavy discussion about whether there will be some second wave or not, but let's see what will happen when these restrictions are taken away. And this is also what happened if we compare with the other Nordic countries together with Estonia. So our levels have all the time been in the lower level. The Sweden is unfortunately in a little bit different curve based on their different strategy which they took in the beginning. And what are the new roles and what are the lessons learned? So about testing, which has been very much discussed internationally during this COVID. So in our country, the sampling and analyzing is always done in the laboratories, what does for every single laboratory test, not in pharmacies. And there are no home tests which are accepted for sales. And as there is this well-functioning testing system in place, I don't see any role here for the pharmacies. And if some home tests will be accepted for the market, then of course we need the quality criteria for this selling process. But this is not really there. There has been 2 trials, but none of them has been accepted. The vaccination might possibly be a future role for pharmacies, but what we really need to be doing in the different way is that we are in a way a little bit isolated from the other healthcare systems, and we need a more collaborative approach so that the pharmacies are a little bit better informed about this. I have some photos about here from my own pharmacy, how we manage through this. So there you can see there are the decisions from the government, the legislation, safety instructions to the staff, our own contingency plan in the pharmacy, and then this information sheet, which is sent to every household in our area, how the distance services work and how they can get help from some NGOs. if they cannot come to the pharmacy or cannot use the mobile things. And then also the local healthcare instructions to customers and to us. And as the other speakers have pointed out, so the cleaning instructions were, of course, making in the new level. And we can see here the different colors for different room types. Procurement process is totally automated. So we don't need to handle with the packages so much, and there is enough space to work with the distance also here from other employers in the pharmacy. Here you can see the customer service. There is a service point where the insurance card is read to the system by the customer himself, and also the paying is done by the card. And we use the wizards and we use the plastic shields here, and then we give the information in these slides. This is the information in entrance. When you enter the pharmacy, we have this robot giving instructions, and we have traditional paper information, and every patient takes a queuing number where they can see that what is their situation. So if there is not enough space, they can wait also outside. Then we give the information about how to take care of your hand hygiene. And then we also inform the customers about how to use these masks and so on. And we also were selling, of course, the masks, and then we needed to be sure that they are certificated products, because the problem with this mask has been enormous. And this is about our distance services. So we have every day several times the deliveries to home. We have the mobile pharmacy where you can see the customer here and then we have this pickup box where you can pick up your medicines. We fill in from the other side and the customers get the number and they get it from here. So with these measures, I think we have managed quite okay, and now the situation is very stable. And let's see what will happen when the summer is here in Finland, and we can be a little bit more free without going out and taking part in the festivities, etc. So thank you. This was my part.
Thank you very much to my very distinguished fellow colleague for this wonderful presentation. Before we proceed with the person who will talk last this evening, there are two topics. I don't want to call them questions, but rather two comments that have come up. So I'd like to read them out, if I may. We have a pharmacist, Burcu Karaüzüm. She's a public pharmacist, and she's pointed out to trials done by the public sector pertaining to drug-drug interaction and efficacy or effectiveness. So again, a big thank you for these trials across to all public pharmacists. There's another comment which comes from a hospital pharmacist underscoring their role. So I would like to go ahead and thank not just Turkish, but also the international community of public hospital pharmacists and public pharmacists across the global community. The last talk this evening, last but not least, I'd like to proceed with from Spain, is dearest Jaime Acosta Gomez. Dearest Jaime Acosta Gomez is currently a community pharmacist in Spain and is also with the FIP, an executive member at the section of community pharmacies in FIP. Canada, Peru, and Palestine are the countries in which, pertaining to COVID-19, he's attended multiple different webinars across these markets pertaining to COVID-19. Dearest Mr. Acosta Gomez, the floor is yours, please.
Thank you for the kind introduction, and thank you to the FIP and TPA for the invitation. Thank you for your attendance at this time of the day. It was my pleasure, as all the other colleagues that are presenting the webinar, to attend the Ankara conference, and I saw a vibrant pharmacy sector. It was very nice. it was very nice. Also, my condolences to the dead pharmacists. Trying to answer a previous question, I checked the FIP information hub, which is available to all pharmacists in the world. There's a lot of information there, and there's the sad figure of 41 pharmacists dead, also from Turkey and Spain and all the countries in the world. Probably there's more than that, but that's what is officially recognized. So I will try to be very fast and try to present my view from Madrid, Spain. Just a very fast presentation of the community pharmacy sector in Spain. We have 22,000 pharmacists, 49,000 community pharmacists. It's very highly regulated sector related to ownership. Pharmacies can be only owned by pharmacists. Medicines can be dispensed only in pharmacies, even OTC medicines, and there are mandatory distances between pharmacies and health centers. What makes this is the biggest network, biggest community pharmacy network in Europe. So it's a very strong network, available and ready to work for the health of the people in Spain. We've been hit very hard by the pandemic. Compared to the UK, we're fortunately for us, sadly for the UK, a little bit lower, but one of the worst countries in the world. We were like 2 weeks in advance of the rest of Europe with Italy, and we as Mr. Shani said, we tried to learn what we were doing, and it was not always easy also for our policymakers, and I understand. But we had many deaths, a lot of suffering, and we're trying now to go back to normal from the 31st of January when we had our first case in the Canary Islands, tourist, to the 13th of March, where there was a complete lockdown, except important works like pharmacy, other healthcare workers, food stores, gas stations, and we're now trying more than 1.5 months. We're trying to get back to normal. Sadly, Madrid has been also one of the worst parts in Spain. You can see the figures compared to Istanbul, Ile-de-France, and London, and another the worst cities in the world. We had an increase of mortality of more than 200% from the previous year. As a symptom of this, our regional government had to turn ice rinks into provisional morgues. One of them is very close to my home, and I used to go there with my kids to skate. And a few months earlier, my oldest daughter went there for a birthday, and it was very shocking to see all the coffins lying on the floor, on the ice floor. It's been heartbreaking. It's been really hard in Madrid. But now we're doing much better. And although this figure is probably not precise, and it's been a little bit controversial, but we are having very low number of cases and deaths in the last few weeks. From the very early, our National Pharmacy Council developed some measures that proposed to our Ministry of Health. The first one, this was from mid-March, when things were still kind of under control. Our government had this on their tables from our National Council, asking to include pharmacies in the emergency protocols, allow the continuation of treatments with exceptional procedures, as allowing us community pharmacists to extend prescriptions, which has been done in some regions, sadly not in Madrid, where our government decided to continue the prescriptions, the electronic prescriptions that were going to expire, extend all of them automatically for 3 months. Probably some of them are not should not be continued, and our government had a network of pharmacists available to serve their patients when most of all our primary healthcare centers and surgeries were closed. Also develop protection measures for vulnerable patients. This is allowing us to deliver prescription medicines to the home of patients, which was banned previously and authorized since this situation. And I hope this is one of the things that stay. Also assure medicine access to the most vulnerable groups. That includes hydroxychloroquine, and we can be very proud that there has not been any major shortage at all, and that includes all the wholesalers, as pointed out by Dr. Giroux. Everything has worked pretty well regarding medicines, not so well regarding hydrogen. In complete, I would say, nightmare trying to find these products. And these are some pictures from community pharmacies, community pharmacists in Spain. This one on the upper left side is my own pharmacy, today available for patients when coming. There is a circuit. This is where our patients should come in and leave this way. You can see protective screens between patients and protecting our pharmacists and technicians. There's one of my head pharmacists with a mask on, and you can see the distancing point, which is not always observed by patients. That causes some misunderstandings. We also used social media a lot, which is interestingly illegal in Madrid. Pharmacists cannot use social media, but we use it as much as we like, because it was very useful to transmit solid evidence-based information. And that is me answering messages and calls from patients who did not come to our pharmacy. And in Spain, we also paid our price. We lost 19 of our colleagues, most of them from Madrid, 12 of them from Madrid. You can see this news in a big media outlet about a couple who died a month ago. I knew them personally. I know their daughters. They pioneered orthopedic pharmacy in Spain, and it was simply unfair for them. They risked their lives, and they lost it. They embraced risk for the sake of the patient, and they knew what they were confronting, and they simply died. These are the facts and figures from the COVID crisis as collected by our National Council. 91% of the Spaniards recognize the essential public service that pharmacies provided. In the first month, more than 30 million people visited a pharmacy when surgeries and healthcare centers were closed. This is more than three-fourths of the Spanish population. It's an important number. 2.2 million have received distant care from their pharmacies, mostly by phone. I hope that this allows us to build a more structured telepharmacy service that allows us to collect data and do it in a more elaborative way, as hospital pharmacists are doing already. More than 800,000 people have received pharmaceutical care at home, also the products they needed. Our National Council developed a campaign by which, if we were asked by a woman in our pharmacy for a mask 19, we knew that this woman most probably was suffering domestic violence at their home. So we could call the police and try to help to solve this issue. This is another example of how we are in both settings, healthcare and social setting. more than 7,000 patients have received hospital drugs in their pharmacy. These patients did not have to go to their hospital, but instead they went to the community pharmacy they always go to and receive advice and counsel by their community pharmacies. And we have also, as it has happened in Turkey and in other countries, masks have been delivered for free in many regions. For example, in Madrid, we are in the middle of delivering 40 million FFP2 masks by the electronic prescription system. So we are sure that people do not collect too many. So they come with their card and we access the system. And if it's still available for them, we give them a mask for free. Also, the role that we might have, as pointed by Dr. Terasalmi before me, we might have a role in tests, also in vaccination and in triage, as it's happened in other countries as Australia or Canada, by which community pharmacists are paid for their advice in triage. But I see that it's a potential role for us, not only in testing as it is happening in other countries with all the issues that might arise, but also by helping people interpret their outcomes. The health minister said when asked if the testing could be done in pharmacies, that it was not possible at this stage because we need the government needs to register the results, and it can be easily solved as it's happening in the US. But for the moment, we are not doing testing in community pharmacy. And lastly, on a personal level, I myself contracted COVID, and I had to leave my pharmacy for isolation in my home for 1 full month. With when everything was, we were at the beginning of the tsunami, not knowing what was going to happen with my pharmacy and my patients, what would happen if my other pharmacist became ill. And I must say that I cannot be prouder of my team. They went every day on time to open the pharmacy, and they were not working for a salary. They were fulfilling their mission as healthcare professionals. And I am so proud of them. This is something I will always remember. And you can see an image. These are some coupons that my youngest daughter made for me while I was confined in the basement. These coupons are worth a kiss and a hug. And I exchanged those coupons as soon as I left the basement. And this is a video my team sent me through WhatsApp while I was confined. I hope you can hear the clapping. And you can imagine myself being confined, not knowing what was going to happen to my pharmacy and my team and my patients, and seeing my pharmacist in front of my pharmacy receiving the clapping from our patients, and seeing they're so proud and so brave. I cried, and I still get a little bit emotional. So this is what we are. We're pharmacists. We're in the middle of the community, and we do whatever we have to do to serve our patients, always. Healthcare centers have closed, hospitals have collapsed, but all pharmacies have been available for the public and the healthcare system. And health authorities have taken good note, also the patients. Thank you.
Dear Mr. Acosta Gomez, a big thank you. And I would also like to wish you a speedy recovery. You have recovered, obviously, but it has been, I'm sure, a major challenge. So that was wonderful to hear. The very first round is already complete. I've received many questions. Many of these questions, or some of these questions, are rather specific. We're only going to be able to take questions or comments as much as time allows. And some questions are obviously a bit of a repetition, so I'm going to try to kind of aggregate questions and kind of ask them to the most relevant person. The question is for Jacqueline, a specific question for Jacqueline Surigu. we have a colleague, and she's asking the following. She says, if I'm not wrong, at the beginning of your presentation, you talked about neuromuscular blockade agents like atropium that received quite a bit of attention. Did you at all undergo shortage of neuromuscular agents or blocking agents? And what is the connection between COVID-19 and neuromuscular blockade agents? Was it administered or was there another reason? Thank you.
Thank you for your question. Yes, there is a relationship between propofol, midazolam, and curare with COVID patients. When you got COVID positive patients with ARDS, severe distress syndrome, you must have them intubated and ventilated in ICU, in the intensive care units. And for this, you have to put curare, and midazolam also is used, and propofol as well. Because when you intubate people, they try to take the intubation off. And it's a very hard and tough thing to support and a tube in your system, and to avoid patients to take off all this very precise ventilation system, you have to put those drugs. So this is why they are being used so intensively, leading to a shortage and leading to the contingency plan that I tried to explain. Is that an answer to your question?
Thank you very much. Thank you. This was very clear, very, very clear and understandable. It's gone on to point to us something that was never ever mentioned before. Obviously, I'm sure many used it in Turkey and also in other markets, but we've only just talked about therapy, the agents that kind of that mitigate the impact of the virus. But there are loads of other agents such as this that have been ignored. So thank you to this question. Thank you for your wonderful explanation. Again, to you and also to Ash this time, a question to Ash and to Jacqueline, to both of you. So I don't want you to leave because you have a second question. We have a capital city, a hospital pharmacist asking the following question, saying, in France, from a French perspective, how do you feel about the Turkey experience, or have you gotten information about the Turkey experience from France? And did you have national guidelines prepared by your ministry? And how do you feel about Turkey? Do you think Turkey has done a good job, or do you have any idea about the Turkish practice? So this is for you, Jacqueline, and then to Ash, if you could both take the question. Thank you.
Well, how can I answer this question? We have a very good friendship in France with Turkey, but I mean, information from Turkey coming to France is not so obvious. So I am aware of Turkish situation more through my FIP position than from a French perspective. What I feel from the presentation that we have had just before, and also from other presentations I attended, I feel that Turkey has implemented things which are very similar to what we have implemented in France. So I suppose it's okay. I think it's a good way of handling the things. So I don't know how Ash can complete about that, but this is what I feel.
It is very difficult to assess because different countries have, in a way, some of what we've seen has varied from country depending on the way the population is spread around the country. We've seen, particularly where there's high densities of people, higher rates of death. We've seen that in the capital cities, as Jaime said, in Madrid, in London, in Paris. We've seen more probably there. What I would say, though, looking at the figures for Turkey, is that the number of cases and the number of deaths is relatively low, and that's a very good result. And actually, maybe one of the things is that learning about how and what happened that maybe we could all learn from in a different way. And I think the other thing that strikes me is that it may well be that you went into lockdown, or some of the procedures you put in place were stronger at various points in the way that you have responded as a country. But I say the opportunity for us must be for all of us to learn from each other about the things that have worked well and how those have impacted on reducing the mortality and saving lives.
Right. So thank you for your kind response. And obviously, there are ample questions coming in. Generally, the question, this is for everyone, and it's a question that seems to be very popular this evening, and it's for everybody. In terms of neuromuscular blocking agents, you've said a few bits and pieces, but was there chaos? Is it that was there stockpiling, and was there like a severe shortage, especially pertaining to hydroxychloroquine? It happened in Turkey, but the Ministry of Health intervened and cracked down because people thought, well, they might want to stockpile because hydroxychloroquine might be protective. So did you see that kind of thing happening in your own markets? Anyone who'd like to raise a hand? Yes, let's proceed with Ash first, and then with Jaime Acosta Gomez. Thank you.
So, yes, we saw some demand for hydroxychloroquine and for chloroquine in the early stages because of the perception that they might be treatments. In the same way, we saw a significant reduction in the desire to use ibuprofen, because there were actually some suggestions that ibuprofen could be more harmful and that hydroxychloroquine and other drugs could be more effective. Fortunately, because of the status of these drugs in the UK, although there was demand, it still required people to get a prescription. They couldn't just come in and buy it. So as a result, it managed to make sure there wasn't a consequence in that respect. Although what we did find was that because of the requirements elsewhere in the world, that did have a consequence generally, because we found that demand that was being placed on drugs in the UK was also relevant for the demand that was being placed elsewhere in the world. In terms of the neuromuscular and the drugs in the intensive care units that were required, we did have stages where there were shortages, but one of the things that government did very early on was it required that procurement for the intensive care units and for ventilator need in terms of respiratory support got priority over everything else. And they were the people that got access to those drugs first. And that was regardless of what any other demand may be.
Thank you very much. Yes, Mr. Costa.
Talking about the neuromuscular blockers, our drug agency released an information sheet of advice to hospital pharmacists to keep the most important ones for ventilation, because there was such a big demand, as in France and the UK and Finland and Turkey probably, that there was a shortage. So they asked, and it was pretty hard to read it when I did that, to keep those drugs for ventilation and try to manage those that were close to death. Those are drugs that can be used in the end of life to be treated with other drugs, so hospitals could save those medicines for ventilation. On that sense, there was also an increase in production of these medicines by the local national industry, and this is also a lesson for us in Europe about prices for medicines and prices of medicines and global manufacturing. Of course, it's very better for lowering the price, concentrating the production. But as it happened with protective equipment, it might lead to a difficult situation. So I hope our regulators and politicians learn the lesson. Regarding hydroxychloroquine, in Madrid, for example, our authorities did not allow community pharmacies to dispense hydroxychloroquine for COVID patients. So it was kept for lupus and arthritis patients. And we had, there was an electronic tool developed by which we had to upload the name of the patient, the name of the pharmacy, the name of the pharmacists, and then we received an approval from our authorities. This was not always fast, but it helped a little bit for in terms of shortages. So our patients had, all of them, enough medicine. Just a comment, my head pharmacist, when she began hearing the news about hydroxychloroquine, she said me, Jaime, we need to order some hydroxychloroquine just in case. And we did that, and we had enough medicines for all the pandemic. That's it.
Right. Yes. Yes, Eva. Yes, please.
Yes, I can also comment on this, say, in two ways. The other one is all those things which were needed in the hospital and for this intensive care unit. So what was the real problem was that there wasn't enough places in the intensive care. And our government took as a strategy to try to move the epidemic curve in a way that we had enough time to build up intensive care for the whole for a bigger group of people, what they had expected in the beginning, and but in no way there was a problem with the medicines, because as I told you, we have these 6 months reserves for every essential medicine in the country, which is circulated all the time, so that they are not getting old in the country, but they are circulating all the time. But we have to have, for all these things, we need these 6 months a reserve. And also the community pharmacies have the obligation that you have to have a storage which covers 2 weeks need in the population you are serving. So in this way, there were the reserves. Of course, what has been the real problem are the masks and then this disinfectants. We solved the disinfectant thing by producing it in every pharmacy. So that was okay, because it didn't took more than 3 weeks and then it went over, and now we don't need to produce anything anymore. And the paracetamol was the other thing, which was very much bought from the open care pharmacies. And we had some shortages, but never really big ones, because there is this reference price system which helps in having always the alternative. So in this way, it was more a structural a problem in organizing the things in the right place in the right time, and to those who really need them. I mean, in the intensive care, but in general, no shortages during this pandemic.
I would like to add something on the hydrochloroquine.
Thank you very much. Yes, Jacqueline.
Yes, we had this beautiful study made by a famous professor from Marseille in France, which has led to some controversy. Now, chloroquine is under clinical trials. It's part of the discovery clinical trials. And hopefully we will have a result on chloroquine and other treatments. But I must say that from my personal point of view, it's very difficult because we do not know enough of the disease itself. Should we be able to say this disease has several phases, and a trial with patients in this phase, the outcome was so, in this other phase, this outcome was different. We should be able to randomize patients in a more secured way. But now The knowledge is the disease is very scarce. And this is why the clinical trials, up to my view, this is a personal view, may be controversial somewhere. This is what I wanted to add on chloroquine. Now, chloroquine is on clinical trials in hospital. You can't buy it anymore like that. It's only through clinical trials.
Right, so thank you very much. There are multiple other questions, obviously, that have come in. There are two questions that I now would like to aggregate or compile them into. Before we proceed, though, before I ask these two questions, there is a few messages I'd like to extend pertaining to hydroxychloroquine. Now, hydroxychloroquine is or has been subject to a great deal of controversy, but then again, it has become one indispensable agent in the sense that it's become a part of all treatment algorithm. One of the questions that have come up is to do with this exactly. In other words, they're saying, has there been any difference among countries in terms of their treatment algorithm? In Turkey, it was updated back on the 1st of June. Hydroxy is now an integral element of treatment. We don't prefer remdesivir. We prefer a Japanese origin patented agent, which is similar to remdesivir. It has been synthesized and it will be locally manufactured in Turkey so far from now onwards as an equivalent agent. So these were kind of clinical observations or observational information, nothing evidence-based. But they believe that pyroprividine plus hydroxy have been clinically effective. Some patients responding more to hydroxy, other patients responding more to the other agent. But their common feeling is that favipiravir and hydroxychloroquine is, so long as there's early administration, once the patient is hospitalized, time spent at hospital has been greatly reduced, they're saying, if there's early administration. So both of these agents have already become mainstay and are part of our treatment algorithm. They're also anticoagulants, such as low-dose heparin. Some patients have been on low doses of heparin plus aspirin. Very recently, aspirin has been added to. And also in Turkey, mortality has been rather relatively low in Turkey. Is that why mortality has been rather modest in Turkey? Because of a strict regimen? So that's one question to everybody. One more question. So the question is, I've given you insights on the Turkish protocol or the Turkish treatment algorithm. So is that really different from your market? Rotenavir plus ropinavir, the combination for children and for pregnants, we know in our protocol that it's especially to be preferred for children and for pregnant women. And also azithromycin. Azithro was very popular in preventing secondary infections, but lately azithromycin is less popular, or antibiotics have become more seldom administered. So are you doing anything different in your own market? In other words, are there differences in between the different nationalities, or is it more or less the same? Before I pass the microphone to you, one last thing, and I'd like to go back and underscore this. Every one of you have been very, very inspiring. But there's one sentence that you've all articulated. You've all said it's a brand new virus and we're yet to learn more. And I more or less said the same thing, that we're now in a learning curve. But now science, in terms of scientific activity worldwide, I have a lot of qualms or question marks. In Lancet and in Nature, I've seen lots and lots of observational studies that came in swiftly. In Lancet, hydroxy has been, in one recent article, hydroxy has been completely underestimated and discredited. And after 1 week, it was retracted. That article in that journal in Lancet was retracted. And that's an awful thing, simply because they couldn't go back and verify or ascertain the evidence. So how do you feel about the pursuit of scientific activity? And one of the questions is, what about medication and vaccine? People are waiting for the right vaccine and the right medication, but there are lots of concerns because the virus has certainly taught us that obviously it's not selective, regardless of nationality or ethnicity or faith. We're all human beings, and social policies, social healthcare policies are paramount in having to deal with this virus. I think FIP may want to deal with this as an umbrella organization to perhaps put an end to kind of commercial interests so that there's safe and sound scientific research and activity, regardless of commercial interests or stakes. And I think there could be kind of perhaps some mistakes made that unfortunately have led to unnecessary deaths. So the floor is for all of you. Go ahead. Yes, Ahmed, let's start off with you. Professor. Yes, I saw Jamie Acosta, then over to him. So here's this thing, and I entirely agree with what you've said so far. My message is, as far as treatment protocols go, favipiravir in particular, as far as I know, in other countries, it can only be administered once a patient is intubated. In Turkey, it's even first time at ICU or prior to ICU admission, patients in Turkey could be on this agent, which is rather exclusive. And also ocrelizumab, which is an interleukin-6 inhibitor, that was also specifically administered in Turkey. Yes, Mr. Costa.
Just a couple of comments. Each country, it's not only about the drug therapy and the protocols, it's also about the social characteristics and the, for example, in Spain, 70% of the dead people were in nursing homes. That's related not only to their age or fragility, that's how workers and the number of staff, people that were working in those nursing homes simply could not stop going there because they needed to take care of those patients. And that's not only related to medicines. Also, another thing about hydroxychloroquine, it's been kind of sad for me how we have treated this without the solid evidence we needed. That puts us in a more important position when the President of the United States kind of recommends a treatment. It's everywhere in a matter of minutes. And as pharmacists, we have a pretty big role trying to inform patients on the evidence of this. We began in Spain treating everyone with hydroxychloroquine, but as long as we've known the illness better, it's getting lower and lower. I could see people coming to my pharmacy straight from hospital with a wrist ring saying that they were discharged in a matter of minutes with their hydroxychloroquine pills. And I tried to tell them to go to their home and then phone them about the evidence of the hydroxychloroquine. We've used also high amounts of corticoids, but this has to do, we cannot simply stop doing what we were doing before COVID. We need evidence. Sorry?
I beg your pardon. I'm sorry for the interception, but what about anticoagulants? There are a lot of questions pertaining to blood thinners or anticoagulants. Did you use them in Spain?
Yeah. Some ICU inpatients were given that. It depended on the condition, not to all patients.
I think Eva, yes, it's over to you.
Thank you. So the problem, as Jacqueline has so well pointed out, is that we don't know enough of this illness yet, and we don't know enough of the virus. So it means that even in the intensive care units, it's more or less a testing. And in this testing, so Finland is participating in the WHO initiative and doing especially work with the remdesivir. And we are not so much using the hydroxychloroquine. It was also prohibited the usage in open care. So, but in the hospitals, I think that all the things you can try, they are tried, but as the results are not clear, and as we still don't know what really could help and what cannot help, so it's going like in a more like a palliative care, to be honest, so that you are intubated and then you just try to keep your basic systems functioning, and then you wait with the time that you start to recover on your own. Unfortunately, this is the situation, because we don't have the cure, which we know that could really work. Totally another issue is this vaccine problem. And I think here we really need to work globally together so that every people who is really in the risk will get the vaccine. Otherwise, it will go all in the market where they are paying most of this, and especially for these reasons we have this our stocks on the essential medicines, because we are a very small market and we are not in the first line in buying anything. So we are very dependent on the European Union collaboration on the issue of getting the vaccine in the future, and also on the global thing. We saw this problem with the masks, because when the normal buying mechanism went down, so the big countries started to buy everything from the market, and they even with the mask were already in the plane, and the plane stops in one country, and then they buy the things which were coming to Finland. So I wonder what kind of international solidarity we will see in this case. So that was my answer. Possibly more question than an answer.
Yes, thank you. Jacqueline, go ahead, please.
You're muted.
Yeah.
Okay.
So I wanted to add that I wanted to add to all what my colleagues have said, that in FIP we have a working group of experts to study all this, the treatments, vaccines, and also the tests. So a very deep literature review will be made, and I think we will come out with some guidance. But I wanted also to react on, I heard one of you saying, talking about treatment chloroquine in early stage of the disease. This is, I don't know what to think about that, because if you don't treat, sometimes, well, most of the time, by the way, the patients recover without any treatment. So if you put a treatment at the beginning of the early stage, what conclusion can you draw out of this? If there is a possibility he can cure himself without any treatment. So it's a bit difficult. It's a very difficult topic. This is what I wanted to add.
Right. Okay, thank you. Let's move on to the second question. So the first question was evidence-based medicine, and the second question is what we've seen a lot happening in Turkey as far as immune system reinforcing agents go. They were really popular, loads and loads of agents that supposedly bolster your immune system, like vitamin supplements, vitamin B supplements, vitamin C, zinc, and lots of mixtures or blends or concoctions, lots of so-called kind of magical formulae. Was that the case in other countries where the community all of a sudden we're in a craze to buy immune system bolstering agents? Was there a soaring demand? And what do you think about this as a pharmacist? Thank you. Yes, please. Ash, please.
So, yes, we saw huge demand for particularly vitamin C, zinc, and in fact, even today, we still have major shortages of both those, vitamin C and zinc. We also have huge demand for vitamin D, and there is some debate at the moment because there is some evidence that people from a black and ethnic minority background in the UK, from the UK research, are twice as likely to die from COVID than people from Caucasian backgrounds. So there's some significant data, and one of the suggestions is that that may be due to vitamin D deficiencies. So there has been a real push about getting people to take vitamin D. But again, part of the problem with all of this is that it's very difficult to know what is effective, whether it's effective at what point in the cycle of the virus, therefore what treatments are going to work. And I think the problem we face from a public perspective particularly, and the same applies to shortages of paracetamol, but as I said before about the fact that people wouldn't buy ibuprofen, is that when messages get spread by social media, by very well recognized personalities like the President of the United States, or by celebrities in various other guises, it creates a massive demand, because from the public's perspective, they don't know what does work and they don't know what doesn't work, but they are fearful of whatever it is. And therefore, whenever any message comes through, they immediately seek to utilize those things to help to treat them. And from a pharmacist perspective, probably the biggest thing we've had to deal with throughout this has been trying to reinforce where we know there is truth, or where we believe there is a lot of, not necessarily misinformation, but lack of evidence to support the information. And we don't tell people that they shouldn't use something, but what we try to do is explain to them about the value there may be or may not be, and that they shouldn't be relying on those things to protect themselves from the risk of this virus. Actually, the things that we know absolutely work are washing your hands, sanitizing, and protecting yourself, and social distancing. And these are the messages that constantly we are having to relay to our patients as being the most important things they can do. And all of these other things may help, but we don't know. But those things we absolutely know do.
Thank you. What about you, Acosta?
Well,
and then Jacqueline.
Okay, I cannot add anything else to what Mr. Soni said. I completely agree. Just to add that we had a shortage in Spain of vitamin C, and I personally did not do much to try to procure that in my pharmacy, since it's not an evidence-based solution. So I simply left it. No vitamin C in my pharmacy.
Yes, the problem is that patients are overwhelmed with plenty of information from all parts. And it's the role of the pharmacist, and it's a big role to educate the patient and the public, and help them to clarify what is true or not true. Coming back to vitamin C, vitamin C works on patients who are depleted in vitamin C, like elderly patients. This is very often the case in elderly. But there is no evidence that a non-depleted patient needs vitamin C. If he takes vitamin C, it doesn't change anything if he's not depleted. So I think we must be very cautious. And here, again, it's a major role for the pharmacists, and especially community pharmacists, who are in the front line with patients every day. Also hospital pharmacists, of course.
Yes, thank you. Our time is passing, but I think we have a little bit of time. 1 or 2 more questions. This is for you, Ash. This question is for you particularly, and it's to do with the UK. The UK initially was not quite so sure. As you said, Eva, or you implied, the Swedish had a herd immunity policy and still do. And during my introduction, I more or less insinuated that the virus has its own story and all countries have their own story, and we're yet to tell whose story is more kind of right in a way. The UK policy had more or less the same intentions, very much like Sweden, to pursue herd immunity. And how do you feel about this personally? Tell us, as a pharmacist, how do you feel about the prospects of herd immunity and whether it would be the right policy to pursue? Yes.
Difficult. So I've seen some data today to say that a large part of the infection that came to the UK came, interestingly, from Spain and from France, and only 1% came from China. Significant part, and that's because of timing. A lot of it came in between the end of February and mid-March. So it was that transition where we had lots of people traveling, and there was no real restrictions within the UK on people moving. What I will say is that herd immunity theoretically makes sense. The problem we have, and from the latest data we have here in the UK, is that 8% of the population have had COVID. That means there are still 92% who haven't. To reach herd immunity, we need about 70% of our population to have developed antibodies in some shape or form to this virus. We don't even know that if you develop antibodies, that protects you from future infection at this stage. We don't know whether that is a long-term protection, short-term protection, or actually gives you no protection. So actually, there's some challenges about relying on herd immunity. I think this is just an example, though, of where, because we know so little and because this is so new, there is still a lot to be learned, and we're still going through that learning phase. And one of the problems, I think, for the UK, and maybe partly the way that Sweden has responded, is that the initial data that came from China indicated that this virus was not as severe in the mortality as it has demonstrated it actually has become. And our learning in some ways came as a consequence of what happened, particularly in Italy and in Spain initially, because it was seeing those systems being overwhelmed that changed policy in the UK. And it was that made the biggest difference, I think, for the way that the UK reacted and responded to this virus. Because, as I say, initially the perception was that this was not as severe a problem as it became.
Yes, thank you. Yes, please, Jacqueline.
Herd immunity is based on the number of patients, well, the number of individual patient who is contaminated can contaminate people. And it is demonstrated that when you got one contaminated patient usually contaminates 2 other patients or more, you should have 2/3 of the population having had COVID to get the herd immunity. So this is what you observe usually with viruses and bacteria diseases. But we have no evidence that this particular virus will react as other viruses used to react. And this is why I say again, we don't know this virus enough, and we don't know the disease enough. And as Ash has told very precisely, we do not know if the antibodies that we observe at the beginning when a patient is contaminated are really protecting the person on a long term. So there are plenty of interrogation points presently. So it's very difficult to answer the question.
Okay, fine. Thank you then. Right now, here's another question, which I'm actually kind of connecting lots of questions together, myriad questions coming in, many questions receiving answers through your elaborate answers. And I suppose there's questions coming in from people who've just joined. Here's a question with Finland, Spain, and Great Britain, and Turkey and France, kind of perspective out of Turkey across these markets. So the outbreak turns into a pandemic, and all countries finding themselves in utter panic. The question is, they're saying, in Finland, in Spain, in Great Britain, and in France, the Union of Pharmacists, which is your professional organization, you might call it an association or a union. Here in Turkey, we've got 54 different chambers, and they're part of the Turkish Union of Pharmacies, operating across all provinces. So the question is, did the Union of Pharmacies set up like a crisis desk, a hotline, and was there kind of communication, kind of suggesting these are the measures or mandates sending out to pharmacists as to the right code of conduct? Was there close kind of interaction, collaboration, and a mandate from the Pharmacists Union? This is one question. And there are other questions suggesting that there might be a second wave. And that second wave may be mild, moderate, or severe. What are some of the lessons learned from this outbreak? What are the things we did right and not so right? And could you perhaps kind of point the needle at let's start off with you, Eva. Tell us also what perhaps your own country did right or did not do quite so right.
Thank you for the question. I think that what went right was that the roles of the different bodies and organizations were so clear, and that we did have the plans, the contingency plans beforehand. So they did exist. There was no panic in a way, and the role of the professional organizations in this situation were also quite clear. They have organized a education, both professional education and then education as an employee role, and about the different ways how to protect your personnel and these kind of things. And they also have the role to discuss with the officials and give the pharmacist a point of view in the general discussion, and tell about the things, how they are going in the pharmacies, and collect the information and spread it forward. And as I already mentioned, I think one of the lessons we have learned is that if the next wave comes, which we don't know yet, but I think everybody is prepared for that, because we see this as a marathon, not a short run. So we keep this disinfectant level, we keep the distance level, we keep the good plexi system and all the isolation systems on place. And we have learned to use them, and I think our customers have also learned to use now the distant services. So all these good things, we will continue with them. There is no need to change our behavior in this respect, because it will protect. We have had much less influenza cases than in a normal year. We have had much less problems in the nurseries with the children's infections than in the normal year. So there are many positive things. In fact, the general number of people dying has gone down during this pandemic. So many lessons to learn, many things to do, and so I think that was my response. Thank you.
Yes, To you, Mr. Costa, how do you feel about this?
Yes, well, and first, for the first question, our national council pretty well. As indicated in my presentation, we developed pretty ambitious measures and very early stage to the Ministry of Health, and they developed some educational materials also with the in line with the FIP information. So that was very useful when we were not receiving the information from our health authorities. And regarding what we have done well was the resilience of the healthcare professionals. Even though we did not have the proper protective equipment, we gave our all for our patients. We adapted pretty well. I think we have the proper character for adapting and evolving. What's been very useful, and also what we should do better for the next potential wave is improve our testing and tracing capacity. This is something we really need to improve. We're not doing well still at this time.
Thank you. To you, Ash, how do you feel about it?
So I think, so from our point of view, very rapidly, all of our professional organisation, the Royal Pharmaceutical Society, and other trade organisations, very quickly, effectively stopped doing anything else. All they did was focus on support for pharmacists around COVID. And what they were doing very much was listening to what we were asking, the things that were challenging for us, the questions we were getting from the public, and trying to support us by looking to find the evidence base to support whatever they could, and to give us as much advice as they possibly could, and to provide professional support, and to give us the confidence to be able to deal in the best way possible with the questions that we were being asked, and to be able to behave in a professional way and support our patients in the best way possible. Where I think we probably didn't do well was that there's lots of discussion about whether we went into lockdown too late. I don't know. It's very easy to look back and say, well, if you'd done this in a week, but you have no idea whether that would have actually made any difference. Part of the problem with this is we only know what we know today. We don't know if we'd done anything different, what would have been the consequence of some of those things. So in a way, in today's briefing from our Chief Medical Officer, he said we're very much in a phase at the moment of learning and of trying to look at the things that will have the biggest impact for the least consequence on on society as a whole, and how we manage that. I think, though, that pharmacy did an extraordinary job, and I think that the public recognized what an amazing thing we had done in the fact that we were available. We were probably the only face-to-face contact that you could get in healthcare, because effectively doctors shut their surgeries and you could only contact them by video conference. So the one place that the public could come and seek advice on a face-to-face basis was in pharmacy. And I think we did an incredible job in adapting as we went, because when we started, we had no knowledge of the things that we needed to do. We didn't understand. We understood some elements of social distancing, but we didn't understand about having to put up protective screens. We didn't understand how to restrict access in the way that we have done. We did all of this learning in a way that is now being used by every other environment to be able to help them to provide access for the public. So I think for a pharmacy, we did an incredibly good job. And I think that the other thing was that from a global perspective, I think pharmacy was really good at sharing some of the things that were happening and some of the learning that was going on, and making sure that through FIP and through other channels that we were sharing the best practice and what was being seen as being valid and relevant to each of our countries. So I think those are the things that I would say we have learned. I think there's a lot more for us to continue to learn over the next period, because I do think there is likely to be a second wave.
Okay, well, thank you. How about you, Jacqueline?
Yes, what I have
Anything to add, perhaps?
Yeah, well, I wanted living such a very strange period in hospitals. You know, all was directed to COVID patients. The profile of the wards were changing. For instance, at hospital, we had no more traumatology because we were locked down. There were no more accidents, car accidents. There were no more sports accidents because we were forbidden to make sport. So everything was completely gone, just absorbed by COVID patients. And I wonder, and this is one of the lessons we should look at, if the normal non-COVID patients has been taken care of in the right way. So we really have to study this, and I'm afraid that now we have maybe many patients coming in the hospitals with more deteriorated health conditions because they were reluctant to come to the hospital at that time. Now, there are two other directions that I would advise to go in details and give further consideration. First of all, the supply chain. Really, with all those shortages, and we have to work on the supply chain. We have plenty of devices that we don't produce in France anymore. That is coming. They are coming from all the world, and sometimes on the other side of the globe. And I think it maybe needs some more thinking that we should have from the pharmacies, that we should have a supply which is available, not obviously locally, but more on a regional basis. The third lesson I would advise to go through is to enhance the technology. All what is remote can be done without any contact. Saving energy and saving time should be implemented and spread all over the healthcare. So this is, for me, the three major lessons to take out of all this experience. And also, the last thing I would like to tell is about the need of a cooperation between all the countries of the world. Because somewhere with this COVID virus, we are on the same boat. Every country is on the same boat, and we should try to rally all together and fight elbows against elbows, all pharmacies together to try to find a cooperation for the future with a certain serenity, if I can say. So this is what I wanted to say. Of course, the new normal will be keeping the safety measures and so on, but these three directions are the best for me.
Thank you. Over to you, Ahmed, to end this round. Yes, please. Yep. Yes, we hear you. Okay, this is my feeling, my opinion. I think this process has been such that from a global perspective and also vis-a-vis loads of other industries in and around the planet, and also from the perspective of our professional organizations in Turkey and elsewhere, it just has been plenty of learning. And it's also taught us that many things can't be predictable. In the background, from the perspective of our professional organization in the public sector, there's been a great deal of interface between government entities and a professional entity. But because it just has been extraordinary, public operations have had to slow down or perhaps come to an entire interruption. Sometimes we had professional organizations doing a good job, sometimes less good. And like everyone said this evening, the there's just so much to be learned out of what's achieved and what has not been achieved. And I think we will build on our future learning based on this experience. Thank you. As we're nearing the end of this session, eventually, I think it has been a remarkable session altogether. A very short question, if I may, actually 2 short questions, and I beg you to be very, very precise, short with your answers, and then I'll pass the microphone back to you to see if you would like to add anything, and then I shall adjourn. So this question, which talks about masks, and if there were to be shortages, would masks be sterilized? Can they be kind of recycled, reused, or do they have to be disposable? And were there incidences where masks really re-sterilized and reused? And also, how about your own government, your own state? Was there financial assistance out to pharmacies in Spain, in Great Britain, in Finland, and in France? Was there financial grants or financial assistance made by the government out to community pharmacists? Thank you. Let's start with you, Eva, and we'll go one by one.
Thank you for the question. About the masks, first of all, I have to say that we don't have any official recommendation about the usage of the masks. And I think it's very wise because the population really don't know how to use them. And they don't understand that they are protecting the others, not themselves. And then they are very expensive. So for a normal family, you should spend at least 200 euros per week to get enough of chirurgical masks, which are for one usage. So they have to be reserved to the healthcare personnel and with the FP2 level, so that this really works. There are some folk masks and these kind of things, but all the evidence shows that they are not really protecting you very well. And we have done in our military some research about whether you could sterilize these masks on the FP level and reuse them, and the results were very positive. So with the oxidation process, you could clean them 99%, but as there now is no need for any this kind of operations, so we haven't started reusing them. But there is the research, so that in case we couldn't get them, we could start this process. Thank you.
And was there financial assistance to pharmacies in Finland from the state?
There is financial assistance to every entrepreneur in Finland, but the pharmacists were not hit so much with this because the customers are using the medicines all the time. So I don't know that any pharmacy has seek for this financial assistance.
Fine. Over to you, Acosta, please.
This recycling of masks have been very controversial from the beginning. It was a very frequent question in our pharmacies, and there's not a solid information that we could provide to patients, especially at the beginning. So as Eva said, some families simply cannot afford to use the masks they need. So our government developed some guidelines for less protective equipment, cloth masks that our patients are advised to wash. On this sense, it's not only about the protection that these masks give. Of course, it's very important, but also it's very important the information on how this mask should be put on and taken off. It was heartbreaking to see at when our government first provided masks for free. It was given by police officers in train stations. They were grabbing the mask inside of the mask and given them just like candy, with no information at all. And that's why dispensing masks in the pharmacies have been so successful. It's not about the masks only, it's about how to use them. That's very important. And about the economic assistance, we have not been given any assistance at all. And we had to invest a lot of money in protective equipment, cleaning, and also staff hours. We've opened, and I'm very proud to say, not for business, but we've opened many bank holidays in Madrid, simply to have shorter lines outside the pharmacy, so people were safer when they came to our pharmacy. And as always, my staff was very happy to come, but they of course they want to be recognized by paying their salary, which is fair. But so on one hand, it's been we have not suffered as much as other businesses in Spain. That's true. But on the other hand, we've had a lot of very expensive costs that have not been covered by our government. And as I had a conversation with a top official yesterday saying that the public health prescriptions were guaranteed the payment from our regional authority for this year, but he was very worried about next year, and those prescriptions are around the 60–80% of the income of regular pharmacy. So I'm very afraid of what's going to happen next year. That's it.
Okay, thank you. Yes, over to you, Ash, please.
So masks is an interesting one, because as of next week on Monday, you'll be required to wear a mask if you go to a hospital. And in fact, today guidance has been issued that in pharmacies, that if you are not able to maintain social distancing, which is very hard in a dispensary, you will need to wear a mask as well. The masks or the face coverings don't need to be of a high standard, because again goes back to the same comment that Eva made, that actually they don't protect you from someone, they protect others from you, and that's the purpose and the way they're designed to operate here in the UK at the moment. Better quality FFP2 and masks are reserved generally for our health professionals, and are primarily the main sites that they are looking at are for hospital trusts where they have confirmed COVID, and therefore they are at highest risk potentially from the virus itself. In terms of funding, again, as Jaime pointed out, our costs have gone through the roof. Because actually we've been one of the few places that people have been able to come. Demand for medicines has skyrocketed. Costs of medicines have gone up dramatically as well. And as a result, the costs being borne by community pharmacy have been significantly higher than they were. We have had access to some funding. Some of the funding that was made available for all businesses was also accessible for pharmacies. And some elements of changes that were made in bills that had to be paid to the state for rent and rates were waived for all businesses, and therefore we gained in a way from that as well. What we have seen is currently that we have been given a cash advance against future income. So theoretically, at some point, that money will need to be repaid, and that will, if it does happen, will have a significant impact on a large number of pharmacies, and I'm fearful that could lead to significant closures. I think the one thing I will say is that I think if there is any risk of that happening, given the goodwill that we have been able to create with the public in community pharmacy, that will have a major impact on the government, and I think that will limit how much they try to draw back of that money, because if they see it having a consequence on access to pharmacy and pharmacy services, that the public outcry will be so great that they will have to stop. But that's not a guarantee. I think that's more of a hope and an expectation.
Thank you very much. Yes, Jacqueline, over to you.
So for the question of the masks, in hospitals, we've been using the surgical masks and FFP2 masks, which is a similar specification as N95. These masks, we were not allowed to reuse them, to re-sterilize them. There is no protocol for that. Those that I have seen on internet, that some countries try to do it and made experiments, especially I saw a protocol from the Netherlands with hydrogen peroxide, H2O2, H2O2, and they are successful in reusing the masks, but this is not allowed in France yet. Now we have all those alternative masks which are coming in and invading the market. What I think is we need some specification from these masks. I think it's quite safe if they are coming from industry, if they are with an industrial process, provided there would be some specification. I think it could be reused, because I know that they are studying on masks that can be washed and ironed. So I think it will come. But now, nowadays, this is the present situation in France. Now, for economic considerations, I am in France. I think we are in the same situation than Eva in Finland. There is help from the government, but it's for any industry or manufacturer, especially when they have been reducing the time. Now I am not really aware of what is the situation for pharmacies, because pharmacies have been stayed open all during the crisis, the outbreak. So I don't know how far they are eligible for this help. Anyhow, it has not been yet in place. It will come. So I think future weeks or months will tell the situation about this.
Right, so thank you. The same question over to also to you, Ahmet. But then again, speaking to you, Ahmet, as far as state assistance is concerned, many of our viewers have also commented as to whether the Turkish Pharmacists Association, whether professional organizations have lent financial assistance. Okay, so the government, the state, like in many parts of the world, hasn't necessarily given financial assistance out to pharmacies, as you get in many parts of the world. It's been more in the sense of kind of low interest charges on personal or commercial loans. But then again, the Turkish Union of Pharmacies has like a solidarity trust, especially to lend again financial loans that are on incredibly cheap rates. So if and when colleagues had financial problems, they went to the trust to borrow cheap loans. The Union of Pharmacies, the chamber, and especially the union, which basically has bigger financial means, but both of them came up with those that were infected with COVID-19, or that were especially in financial distraught, or those who passed away for their families. So there was like financial assistance lent out to them in particular. So there was financial assistance of that sort. What about masks? How do you feel about masks? Okay, you mean whether or not to sterilize and to reuse? This is how I feel. And I remember mentioning this earlier on. Essentially, I think that for the future, and the kind of experiences that we have had so far, I'm not concerned. I know that we've learned a lot already, and more or less it is kind of like more predictable from now onwards. So even if there were to be a second outbreak, speaking of masks, or like Jacqueline said, like the new generation masks, they will make it to market very soon. So I'm not that kind of concerned as to whether or not masks will be a problem. Disposable masks were a bit of a problem. There were shortages, and prices skyrocketed. I know I've heard a lot of people saying that they were reused and re-sterilized or sterilized at home. Okay, well, thank you to everybody. I'd like to do a bit of a recap, but before I do that recap, I'd like to once again ask you whether or not you want to add anything. Any, I don't know, additional thoughts, feelings, anything at all? And over to you, Acosta. In particular, the Turkish Union of Pharmacies sends out their best wishes to you. I've just seen that message now. They're wishing their best. So on behalf of all pharmacies in the country, they wish you the best.
Thank you. I'm doing pretty well now. Thank you.
Okay, fine. Let's start with you, Eva, in terms of last things to say, and then I will do a recap and eventually adjourn. Go ahead, Eva.
Well, I just want to thank you so much for organizing this webinar. And I think it's very important that we can talk globally together as colleagues, learn from each other, and they have the possibility to change the experiences, the professional experiences and the knowledge. So I think I could have helped you in a way, and I thank you for giving me the possibility to learn from all the speakers during the evening and from the questions presented. And I want to thank you for moderating this webinar, and I want to thank the organizers for giving us the possibility to meet this night and feel that we are all proud pharmacists doing the best we can. Thank you.
Thank you. Over to you, Acosta.
Well, just two messages apart from what Eva said. Thank you again for the invitation. It's been thrilling sharing information and seeing that pharmacists, despite of different backgrounds, are not so different from one country to the other. We face the same problems and the same issues, and also the same strengths. So just as a final message, we should not, as a profession, let this crisis go away without taking a sad advantage out of it. As pharmacists, it's not only about delivering the best and compassionate care that we can to our patients, but also supporting our organizations so they feel that they have us behind them when they confront politicians and go to a parliament. They must feel that they have the profession pushing for changes, the changes we need to take advantage of this crisis and provide even a better service.
Thank you very much. How about you, Ash?
So again, just to reiterate, thank you for the opportunity and for the chance to learn of some of the things that are going on elsewhere and to hear and understand the challenges that we all face, and recognizing that actually we are in a very similar position, and as a profession we are doing very similar things. And it makes me extremely proud to be a pharmacist. One of the things that this has shown me is just how valuable a profession we are and how we are so undervalued sometimes until we really are needed in situations like this. And I think that's an incredible position to be in some ways, but we must make the most of this to make sure that we are recognized in the future. My final comment is that something that maybe I read somewhere else, but it's something that I think should be a lesson for us all. We are seeing the consequences of a vaccine-free world. And if we don't use the opportunity to see how this ensures that more people recognize the value of vaccination for other diseases and to prevent other illnesses, then again, I think we have failed in one of the things that is critical for us to do, and that we shouldn't undervalue the fact of pharmacists vaccinating and addressing the public health needs of the world.
Thank you very much. And now over to you, Jacqueline, please.
So thank you very much for giving me the opportunity to share with you this evening. I would like to stress the system we have been using, Zoom. Zoom has been exploding these last years. Following GoToMeeting, now we are always in Zoom because you can see, it's like a virtual meeting, you can see each other, and this is a really very great step. What I would like to say, in addition of what I don't want to redo what my colleagues have already said, but I would like to take this opportunity to send this message to the audience. Come with us, join FIP, come to work with us, because it's really through a cooperation and a collaboration between all the pharmacists of the world that we will be able to go further. Thank you very much indeed. Thank you.
I thank you. Over to you, Ahmed, to do the closing remarks. We started off with you at the beginning, if you recall. Okay, so I'm going to say more or less very similar things in general. My first message is the fact that this event has taken place amongst such eminent counterparts. It's been a fantastic experience. A big thank you to the people who have made this possible this evening. I think events like this ought to be happening much more frequently, either through Zoom or through other media. And perhaps you'll be physically in Turkey someday in the future. So thank you, everybody, for the post sharing. Okay, well, last but not least, I'd like to take the floor now and do the closing. Whilst I do the closing, I'd like to just reiterate a few things. We have from edzalzone.com, right? So that's the web address. You're welcome to go back and watch this if you've missed out, or if you only kind of managed to attend one bit. It will be recorded and made available. And there were some questions saying that, will there be more of this? I think that Zoom and digital applications like this are going to become more and more mainstay, and we'll probably be meeting other nationalities in the future. I found this lovely, and I've learned ever so much from every one of the participants this evening. So as I close, I'd like to go back and underscore a few messages. Ava from Finland, she talked about the Finnish incident, and she said something that was really important. I think it goes on to perhaps become a take-home message for this evening, or a key message for this evening. And Eva said that we had a plan. She said we had a plan, according to which we went on to implement that plan immediately. Actually, all countries had a plan, didn't we? All countries had more or less a plan, or have a plan. It's impossible not to. Speaking of public health care, outbreaks are almost always imminent. We studied this back at school, etc. So, I know there was a great deal of exaggeration that in such and such country they predicted it, or all sorts of conspiracy theories suggesting, many could claim that the Finnish knew this and perhaps they're the ones that actually manufactured the virus. Of course, that's a joke, but we have to have a plan. We must anticipate. We've got to be ready according to a plan or a roadmap. And it's all about, or it's down to crisis management. I've gone on to witness that Great Britain, France, Turkey, and Finland and Spain, we've all got common problems, both at a pharmacy level or as community pharmacies, or the pharmacist population, or also from a population perspective. We've got so many issues to share, especially in dealing with COVID-19. Henceforth, here's the connection with the second outbreak. Whether or not it happens, we've now become a corona family. The coronavirus, very much like the Spanish flu, the first outbreak can be kind of slower, but the second outbreak can be bigger and more powerful and more detrimental. So let's not overlook it. Let's be vigilant. And also, we've not just been viewed locally, we've also received messages from other markets. And I've more or less done my best to try to aggregate these messages. Some of these messages I might have missed out. So apologies to the people who've been viewing the session, because it's impossible really, to watch you and then to be going back to flick through the questions. And there's just been tremendous appeal altogether, a lot of attention paid. But here's the thing we have to do, as a professional organization. And by the way, FIP this evening has proven just how powerful it is. We could do loads of things, medication, vaccines, but having 3 vice presidents with us this evening has just been so rewarding. So my message to everybody is, look, speaking of human welfare, well-being, we need medication and we need vaccines. And this is our job. It's our responsibility. The WHO chief had plenty of concerns, and so did everybody else. And Eva said this, that when the vaccine comes out, it's got to be available, made sustainable. How much is it going to cost? How many people will be able to access the vaccine? So I think FIP is a wonderful organization to bring up these issues. Unfortunately, medication, science, it's all got to be evidence-based. And let's not undermine this. We need to pursue science with a view towards building evidence. Let's not keep thinking that agents are a business or are there to generate income. Unfortunately, that could be detrimental for mankind in general. I think that could be one kind of future problem. I think the FIP is a wonderful institution to bring this up and to kind of deal with this from a more altruistic fashion. We need to be delivering some sort of a solution to make this happen. And in summary, all countries have their own union or their association. I'm sure you might have perhaps done this already, but a call out to everybody, including my Turkish counterparts. We need a crisis desk. If we don't have a crisis desk, let's build one. Let's invest in education, educating everybody in and around COVID-19. Everyone this evening said a lot has been achieved in educating pharmacists and their employees. So the more information that we get, the more knowledge, the more we need to be fresh. We also need to anticipate a future wave. Okay, so I thank everybody one by one. Big thank you. I also would like to extend my cordial greetings, my heartfelt greetings out to everybody, and my heartfelt love to your citizens and to your communities. Good evening.